My research is a traditional review, and the topic is pathophysiology and clinical implications of cognitive dysfunction in fibromyalgia. So a bit of introduction regarding fibromyalgia. As we all know, fibromyalgia is a rheumatological condition. And if you're thinking about the incidence and the prevalence, it's prevalent about 2% in females and about 0.15% in males. And the term fibromyalgia as such was earlier known as fibrositis, but they realized that it's no longer an inflammation. And by 1976, the term fibromyalgia was coined. And in this, the term fibro stands for the fibrous connective tissue and myalgia stands for pain in the muscles. So it is, in fact, a rheumatological condition characterized by muscular or musculoskeletal pain, along with stiffness and localized tenderness at specific points in the body. So in the figure, we can see that it is, in fact, a syndrome or a multi-system dysfunction. In the brain, it can cause the symptoms like tiredness, sleep disorders. And by the way, whatever is mentioned in red are the main symptoms and blue are the secondary symptoms. So in the central nervous system, it can lead to tiredness, sleep problems, concentration problems, headache, and fatigue. And all these memory and focus problems are collectively known as fibro fog, and it can also lead to depression. And in the musculoskeletal system, it can cause neck as well as back pain, can cause musculoskeletal chest pain. It can cause difficulty in swallowing, pain in the tooth, increased sensitivity to noise as well as light, as well as sensitivity to cold. In the cardiovascular as well as respiratory system, it can cause arrhythmias, shortness of breath, and increased susceptibility to infection. In the gastrointestinal system, it can cause irritable stomach, irritable bowel syndrome. It can also cause swelling in the hands or the feet or the face. And this pain is usually chronic, along with joint pain generally, as well as more in the arms as well as legs. And it is associated with some morning symptoms, cramps, as well as shivering or trembling in the hands. The statement of the problem in this traditional review. So cognitive dysfunction is a main complaint of many patients presenting with fibromyalgia. But as clinicians, we often underestimate these cognitive complaints. In fact, we even fail to recognize pain as a disease. And we think of pain as a symptom and we treat it, and we often tend to ignore the cognitive complaints. And the fact is that the proper management of all the symptoms, including the cognitive impairment at an early stage, can have a great positive impact on the health of the patient. And this will improve the mental health, the physical function, as well as the overall health of the patients. The aim, this is a traditional review, and it is based on the literature from the past 5 years from PubMed. And I've taken the full text as well as abstracts, and a total of 29 papers have been taken into account. And it excludes any paper that is related to other symptoms other than cognitive complaints related to fibromyalgia. And the objectives are to address the pathophysiology of cognitive dysfunction in fibromyalgia patients, to find out the risk factors of cognitive dysfunction in the patients, to discover the recent modalities of the treatment, as well as to figure out the clinical implications, as well as the recent recommendations. So the scope of the study is mainly addressing the pathophysiology, looking into some of the risk factors of why cognitive dysfunction occurs, as well as we are trying to look at the impact of external environments on the cognitive function in these patients. It is also looking at new modalities of management of fibromyalgia as well as cognitive impairment, like non-invasive brain stimulation. It's looking into the implications of fibro fog in clinical practice and the importance of diagnosing it earlier. and also the testing and the treatment of fibromyalgia. Limitations. I could find out very less number of evidence-based studies. Most of the studies were case control studies or structured reviews, and they even included only a few number of patients. The Newcastle Ottawa tool has been used for the case control studies, and the AMSTAR criteria or the tool has been used for the structured reviews. Specific subtopics regarding the research paper were discussed only in a few number of studies as well. Now coming to the research design and methodology. So as I said, it consists of a total number of 29 studies. And we are mainly looking at the pathophysiology, risk factors, the new modalities, and the clinical implications. 9 of these papers were related to the pathophysiology. 8 of them were case control studies. 1 was a structured review. I could find 5 papers talking about the risk factors. 4 of them were case control studies, and 1 was a prospective questionnaire. 4 of the papers helped to know about the new modalities of treatment. 3 of them were RCTs, and 1 was a structured review. 12 of the papers gave an idea of the clinical implications, out of which 7 were case control studies, 2 were systematic reviews, 1 was an RCT, 1 was an open uncontrolled interventional study, and 1 was a prospective questionnaire study. Now the research findings are again talking about the pathophysiology, the risk factors, and the new modality of the brain stimulation. First of all, coming to the pathophysiology. One main pathophysiology that's talked about in the papers is regarding neurotransmitters. So the excessive consumption of neurotransmitters in the brain. So we know about the neurotransmitters like glutamate, serotonin, as well as norepinephrine, GABA, etc. And we are trying to find out how these neurotransmitters link the symptom of pain to cognitive dysfunction, and how they are related in the pathophysiology of the fibro-fog as well as the fibromyalgia. So the excitatory neurotransmitter like glutamate, for example, is related to pain, at the same time is related to memory. Something like serotonin is, which acts as both excitatory as well as inhibitory, is related to sleep-wake cycle and is important in maintaining a good sleep, and it's related to pain as well. The inhibitory neurotransmitter like GABA again is related to attention and concentration, just like norepinephrine, and both of these are again related to pain as well as cognitive function. So the excessive consumption of these neurotransmitters in the brain in response to excessive pain sensitization. So the eating up of these neurotransmitters is leading to a wastage of the neural resources that is needed for other brain functions like cognition. So that's the first pathophysiology. And the second one is related to neural noise. So what exactly is neural noise? Neural noise actually is the random electrical fluctuations in the neural networks, or in simple terms, we can say that it's like an electrical chat or conversation between neurons in the process of trying to recollect memories. And actually the production of these neural noises while we are trying to recollect a memory can have a negative impact. It would decrease the sensory processing as well as subsequent cognitive performance. And in simple terms, I can give you an example of the neural noises. Like, suppose if you're trying to read a telephone number, and the time gap in between reading it and actually dialing it, we are trying to recall the numbers. It's like a visual spatial memory. And this creates a neural noise. But the more we struggle to try to recollect something like this, it creates a neural noise, and it is a feature of cognitive impairment. And increased neural noise has been found in many studies in patients with fibromyalgia. Also, the fibromyalgia patients, they have difficulties in mobilization, as well as preserving the visual attentional resources. And this in turn, like I said in the above theories, explains the cognitive impairment. Another one is reduced pain threshold as well as a defective inhibitory modulation of the nociceptive input. Some studies say that chronic exposure to pain can actually lead to a very higher threshold for response to pain, but most of the studies have showed a very reduced pain threshold on exposure to chronic pain and stress. And this is a kind of maladaptation to stress as well as chronic pain. And also high STDT in fibromyalgia patients. So STDT is the shortest time interval which is necessary for a pain of tactile or a touch stimuli to be perceived as separate. So this has found to be high in many of the studies in fibromyalgia patients. Another theory is that severe or chronic stress exposure leads to stress maladaptation, leading to low cortisol levels. So the chronic exposure to stress leads to a continuous production of stress hormones like cortisol. And ultimately, it leads to a stress maladaptation, leading to production of low cortisol levels. And the low cortisol levels have been found in many patients with fibromyalgia. Also, the stress exposure, it can affect the higher cognitive and executive functions, not just in fibromyalgia patients, but also in non-fibromyalgia patients. Now we'll talk about the risk factors. So the study designs include mostly case control, structured reviews, and prospective questionnaires. So if we take a case control study, so first, 104 patients with neuropathic pain, 99 of them with musculoskeletal pain, 51 with fibromyalgia, and 72 with healthy subjects were taken into account. The risk factors we took into account were pain and depression. And what we could find is that cognitive performance was lower in fibromyalgia patients, and that depression has a very negative impact on fibromyalgia patients as well as patients with musculoskeletal pain. Now we're talking about some of the scales that are used to assess fibromyalgia as well as the cognitive dysfunction. So an increased visual analog scale and increased hospital and anxiety depression scale scores were associated with reduced cognitive performance in the fibromyalgia patients. In another case control study, which included 42 fibromyalgia patients and 30 healthy controls, the risk factor was pain. And the result was that there was an inverse relation between pain intensity and cognitive performance. So higher the pain intensity, lower was the cognitive performance. In another case control study, 17 low depression fibromyalgia patients were taken, and 18 high depression fibromyalgia patients were taken along with 18 healthy controls. The risk factor was depression, and an inverse relation was found between depression and cognitive performance. In another prospective questionnaire, takes into account 66 fibromyalgia patients. The risk factor was tobacco smoking. And we could find that tobacco smoking is associated with reduced cognitive performance, worsening quality of life, an increased sleep disturbance, as well as an increased incidence of anxiety. And all of these, again, are compounding as symptoms or features of fibromyalgia. In another case control study, which had 52 fibromyalgia patients and 32 healthy controls, the risk factors were pain as well as high BMI, and an inverse relation was found between pain intensity and BMI. And now we are trying to look at some of the new modalities of treatment like brain stimulation, which can be used in fibromyalgia patients. And here, the study design, first we took into account was an RCT, which had 40 patients. And the aim was to assess the effect of transcranial direct current stimulation on the dorsolateral prefrontal cortex. And the result was an increase in the performance as well as executive attention network, as well as an increase in the pain threshold as well as the heat pain threshold. In another RCT with 20 patients, we aimed to assess the effect of transcranial random noise stimulation of the M1 motor cortex in the fibromyalgia patients. And the result was a significant improvement in the tests like verbal fluency test, trail making test, fibromyalgia impact questionnaire, as well as the Ray auditory verbal learning test. So these are some of the assessment tools for fibromyalgia and cognitive dysfunction. And also there was an improvement of pain and depression symptoms. Another RCT took into account 40 patients, and it assessed the effect of the direct current stimulation as well as the dorsolateral prefrontal cortex with the working memory training on the fibromyalgia symptoms. And the result was a very significant improvement in the immediate memory, as well as an increase in the orthographic as well as semantic verbal fluency scores. So these tools, the impact questionnaires as well as the fluency scores were assessed. And also there was a significant improvement in short-term memory. And the structured review took into account 16 studies, and it aimed to assess the effect of various transcranial electrical stimulations on the M1 motor cortex as well as the prefrontal cortex. And the result was that the targeted stimulation of the M1 cortex by the direct current stimulation, it has a very great effect on pain reduction, while stimulation of the prefrontal cortex has less effect on pain reduction and might have a very limited effect to improve the cognitive dysfunction. So these were some of the very useful findings from the tests done, which could act as an innovative method of treatment of fibromyalgia patients. So some of the conclusions that can be drawn from the study is that the cognitive dysfunction in the fibromyalgia patients, it might be caused by various mechanisms in the brain, like we saw about the hormonal as well as the metabolite changes, as well as excessive pain perception, the stress maladaptation, the low cortisol levels, as well as the neurotransmitters, which link pain as the symptom of pain to cognitive dysfunction in fibromyalgia patients. The study has also demonstrated the importance of screening cognitive complaints in fibromyalgia patients, because as clinicians, we do not tend to see pain as a disease. We tend to see pain as a symptom in fibromyalgia patients, or as the main symptom in fibromyalgia patients. And we tend to treat the pain with either painkillers, or we might even think of offering some exercises, acupunctures. In case we are finding an element of depression, we might prescribe antidepressants, cognitive behavioral therapy, or even second-line anticonvulsants like pregabalin is an option usually, but we never actually think of assessing the extent of cognitive impairment in the fibromyalgia patients. And this study is making us realize the importance of assessing the extent of the cognitive impairment and how the cognitive impairment can occur as a result of the chronic pain exposure. And that how important is the proper early management of pain, as well as the early diagnosis and management of cognitive impairment in the overall improvement of fibromyalgia patients. And also, we have seen about some very useful tools which can be used to assess the cognitive dysfunction. That has also been discussed, along with the idea of using affordable as well as effective non-invasive brain stimulation therapy even at home. So what are the recommendations of the study? The study is mainly directing researchers to conduct more studies about the risk factors as well as the diagnostic procedures, which can help in further development of clinical approaches to manage fibromyalgia as well as fibrofog. And on an end note, I would like to see the thought, which is a saying by pharmacist and researcher, Dr. Scott Strassels. This will help us to realize the importance of this paper as well as this topic, because fibromyalgia is usually a very underestimated as well as underrated topic, especially the cognitive dysfunction component of fibromyalgia. So it says what many people do not understand is that pain itself can cause side effects and can affect the concentration and mental clarity just as profoundly as any drug. So thanks a lot. That is the end of the research presentation. I would like to express my sincere gratitude to Scientex conferences for giving me this opportunity. And also this research is affiliated to California Institute of Behavioral Neurosciences and Psychology, and would like to express my gratitude to my mentor, Dr. Hassan Tohud, as well as my colleagues there at CIBNP. Thank you for listening to me. Thanks a lot.